5 medical checkups you should think twice about after turning 70, because they might do you more harm than good. There's a hidden truth most seniors will never hear directly from their doctors. Every year, millions of older adults undergo routine tests, believing they're protecting their health. But what if I told you that some of those so-called standard checkups could actually push you closer to risky procedures, unnecessary treatments, or even serious illnesses you never expected? Before we continue, an important note. This video is for educational and informational purposes only. It does not replace professional medical advice. Our Dr. Laura is sharing general insights. Always consult with your healthcare provider before making decisions about your health. Recent studies reveal that a surprising number of medical tests in people over 70 lead to unnecessary treatments and side effects that reduce quality of life. And shockingly, most seniors are completely unaware of these risks. Today, we'll uncover 5 medical checkups you should carefully reconsider after the age of 70, and what they can truly do to your body. All explained clearly and based on scientific research, so you can make informed choices instead of going in blind. And I'd love to hear from you. Let us know in the comments where you're watching from, your age, and if you've ever regretted a test or medical procedure. Do you think seniors are being tested too often? We'll be reading and responding to as many comments as possible with helpful tips. Don't forget to like this video and subscribe to our channel for more content like this. Now, let's dive into the first checkup on our list. It seems harmless, but it could quietly ruin your quality of life. Checkup number 5. Bone density scan. On the surface, it looks simple, a quick, painless scan that measures how strong your bones are. It's mainly used to detect osteoporosis. But here's what most people aren't told. After age 70, these scans often create more fear than real benefit. That's because bone density naturally decreases with age. Just like wrinkles or gray hair, it happens to everyone. But when the scan shows slightly lower numbers, many seniors are pushed into taking medications meant to strengthen bones. The problem? These drugs can cause serious side effects, including digestive issues, irritation in the esophagus, and even a rare condition where parts of the jawbone begin to die. Scientific evidence shows that treating mild bone loss in people over 70 with these medications has very little impact on preventing fractures. In fact, lifestyle changes, like strength training, balance exercises, a nutrient-rich diet, and correcting vitamin D deficiency are far more effective. Take the case of Rose, a 76-year-old retired piano teacher. She felt perfectly fine, with no falls or pain, yet her scan showed mild bone loss. Her doctor prescribed medication that soon left her with painful reflux and jaw aches. Once she stopped the pills and switched to daily walks, resistance band exercises, vitamin D, calcium-rich foods like sardines and leafy greens, her health improved dramatically. She was back at the piano within a year, stronger and more energetic than before. A number on a screen should never control the rest of your life. For many seniors, the best prescription isn't found in a pill bottle. It's in maintaining a healthy lifestyle. And this is just the beginning. The next checkup on our list may be linked to something even scarier, the risk of brain surgery. Checkup number 4. Brain MRI for memory loss. Let's talk about the next one, the brain MRI for memory problems. When seniors start noticing more forgetfulness or moments of confusion, the first reaction is often fear. Fear of dementia, fear of Alzheimer's. And in response, many doctors order a brain MRI. Here's the uncomfortable truth. While MRIs provide detailed images of the brain, they rarely give the answers patients are looking for. In most people over 70, the scans simply show normal age-related changes. Things like slight shrinkage or small white spots that naturally appear with age. The problem is, once those findings are spotted, they often trigger a wave of anxiety, more testing, sometimes even invasive procedures that don't actually improve memory. In fact, unnecessary interventions can sometimes make things worse. A large study reviewed thousands of mysteries in people between 70 and 85 who had mild memory complaints. The results? While 86% showed some kind of brain change, only about 3% pointed to a truly treatable condition. That means the vast majority went through the stress of being told something was wrong, when in reality, their results were normal for their age. Even worse, many were pushed into invasive tests like spinal taps or exploratory biopsies, all because of vague scan results. Take George, a 74-year-old retired engineer. He came in worried because he misplaced his keys more often and sometimes forgot names. His MRI showed those common white matter changes, and he immediately feared the worst. He stopped driving, avoided social events, and his anxiety spiraled. But after a proper cognitive test, his memory scored within the normal range. With some simple lifestyle changes, better sleep, hydration, daily brain exercises, his memory stabilized and he got his life back. The truth is, unless there are severe neurological symptoms like seizures, sudden personality changes, or rapid decline in function, a brain MRI is rarely helpful for mild memory loss. A far better first step is a simple cognitive screening test. Quick, paper-based, and proven to be effective without the emotional toll. Brace yourself, because the next test is one of the most common given to seniors, and it can come with serious risks. Checkup number 3. The cardiac stress test. The cardiac stress test is often ordered when older adults report feeling a bit more tired, notice some mild chest tightness, or simply say, "I don't have the same energy I used to." The test involves monitoring your heart while you walk on a treadmill or while receiving medication that mimics exercise, to see if your arteries are blocked. On the surface, it sounds reassuring. But after 70, it can actually do more harm than good, especially for those who don't have clear signs of heart disease. Here's why. In seniors, the accuracy of stress tests drops significantly, okay? In fact, studies show the false positive rate, where the test suggests a problem that isn't really there, can be as high as 40%. And those false alarms lead to follow-up tests like angiograms, and even unnecessary stent placements or bypass surgeries. One major study found that more than half of the stents placed after stress test referrals were done in patients who gained no improvement in survival or quality of life. What they did experience, however, were higher risks of bleeding, kidney damage from the contrast, dye, and longer hospital stays. Consider Raymond, a 75-year-old retired mail carrier. He stayed active, walking daily, but mentioned to his doctor that he sometimes felt tired on hills. Just to be safe, a stress test was ordered. The results were unclear, so he was sent for a catheterization. They found a mild narrowing and placed a stent. That very night, Raymond had a reaction to the contrast dye, damaging his kidneys. He ended up hospitalized for nearly a week. And the fatigue? It never changed, because it wasn't a heart issue at all. He simply needed better hydration and more rest. If you're over 70 and not experiencing classic warning signs, like chest pain during activity, shortness of breath with exertion, or a sudden drop in stamina, a stress test may do more harm than good. In many cases, safer alternatives like a resting EKG or a coronary LCM scan can provide helpful information without the same level of risk. Checkup number 2. Colonoscopy. You might not have expected this one. But colonoscopy, a procedure that uses a camera to examine the colon, is not always a wise choice after 70. And it's rarely recommended after 75 unless there are specific warning signs. The risks rise sharply with age. The preparation itself is harsh, involving powerful laxatives that can cause dehydration, dizziness, or even kidney problems. Sedation, which is almost always required, carries its own risks, especially to brain function in older adults. And the procedure itself can sometimes lead to complications like bleeding, tears in the intestine, or irregular heart rhythms during sedation. A large study of more than 1 million seniors found that for every 1,000 colonoscopies performed in people over 75, only 2 lives were saved, while more than 20 people suffered serious complications. That's a 10-to-1 risk-to-benefit ratio. And even when polyps are found, most are small, slow-growing, and unlikely to ever cause harm. Removing them in someone older can sometimes do more damage than leaving them alone. Take Dana, a 73-year-old grandmother who helped run her family's bakery. She had no symptoms, no changes in her bowel habits, and no family history of colon cancer. Still, her doctor urged a routine colonoscopy. During the procedure, a small polyp was removed. That night, she developed severe abdominal pain and collapsed. At the hospital, doctors found a perforation in her bowel. She spent over a week in recovery, lost weight, and never regained her old energy. And the shocking part? She had already had 2 clean colonoscopies before this, meaning the new one was completely unnecessary. Current medical guidelines recommend stopping routine colon cancer screenings at age 75 for most people. For those in excellent health, safer alternatives like the FIT test, a simple at-home stool test, can detect warning signs without the risks of sedation or invasive procedures. It's cheap, safe, and effective. Talk to your doctor about whether there are better options for you. Because once you enter the colonoscopy cycle, it's often difficult to step out. Checkup number 1, full-body CT scans, and finally, the most overused and potentially dangerous test of all, the annual full-body CT scan. These scans are often sold as part of luxury health packages, marketed as a way to catch cancer early. But here's the shocking truth. They expose your body to massive doses of radiation, equivalent to hundreds of chest x-rays in a single session. And for adults over 70, the risks far outweigh the benefits. There is no evidence that full-body scans in people without symptoms save lives. What they do cause is a chain reaction of unnecessary follow-ups, biopsies, and even surgeries, all from detecting tiny, harmless abnormalities that are simply part of normal aging. A recent study estimated that up to 5% of all cancers may now be linked to medical radiation from CT scans, putting them on par with alcohol as a cancer-causing factor. That means 1 in 20 cancers could be caused by the very scans meant to prevent disease. Consider Marcus, an energetic 80-year-old who loved teaching martial arts to fellow seniors. He felt perfectly healthy, but decided to take part in a private full-body scan package. The scan revealed a tiny nodule in his lung. Panic set in. He was referred to oncology, underwent more imaging, and finally a biopsy. The result? Benign. But the biopsy collapsed part of his lung, leaving him hospitalized for 2 months, all for something that never needed treatment. Experts now strongly advise against full-body CT scans in symptom-free adults. The American College of Radiology is clear. There is no proven benefit, only significant risk. If you ever experience concerning symptoms, such as unexplained weight loss, persistent cough, or visible swelling, then targeted imaging is the right choice. But scanning your entire body when you feel fine is like searching for treasure with a mine detector. You may find something, but the damage could be far worse than the problem. Closing thoughts. So there you have it. 5 medical checkups that may seem helpful but can actually harm you once you repass 70. Medicine is powerful, but it's not perfect. Sometimes, less really is more. It's always ask before a test. What happens if this shows something? What are the risks? And will the results truly change my care? If the answers are unclear, it may be better to pause. Real prevention doesn't come from endless testing. It comes from lifestyle, staying active, eating nutritious foods, getting good sleep, and managing stress. These are the habits that truly extend life and protect health. Now, I'd love to hear from you. Have you or someone you love ever faced complications from a medical test that turned out to be unnecessary? Share your story in the comments. We read every single one. And if you found this video helpful, Don't forget to give it a like and subscribe for more evidence-based health insights with Dr. Laura.